My name is Robert Fox, and I will be sharing with you the top-line results of EMPhASIS, a Phase 2 clinical trial of vidofludimus calcium, or IMU-838, in relapsing MS. And here are our disclosures. IMU-838 is a next-generation small molecule DHODH inhibitor. It is in the same class as teriflunomide, but lacks off-target effect on kinases, which may reduce side effects, and also has a much shorter half-life. This Phase 2 proof-of-concept trial enrolled men and women between age 18 and 55 with relapsing MS and disease activity over the last 1 to 2 years. Treatment assignment was double-blind over 24 weeks with MRIs every 6 weeks. Here is the trial schematic. 2 doses of 838 were studied, 30 and 45 milligrams. I will share the results from this blinded main treatment period. The primary outcome was cumulative number of new combined unique active lesions up to week 24 in the 45 milligram group. The key secondary outcome was the same comparison in the 30 milligram group. Here is the patient disposition, which shows excellent study retention with little dropout. The study met its primary and key secondary endpoints, with a 62% reduction in combined unique active lesions in the 45 milligram group and 70% reduction in the 30 milligram group. Forest plot analysis of different disease and demographic covariates found cohesive and robust reductions across various subgroups. The additional secondary outcomes showed consistent benefit. The time course of GAD lesion reduction was constant throughout follow-up. Neurofilament, relapse rate, and EDSS were all directionally consistent, although no formal statistical analyses were performed because a multiplicity adjustment was not planned. Turning now to safety, there was no difference in the rates of adverse events or serious adverse events between treatment groups. Focused attention on renal and hepatic safety found no evidence of toxicity in those organs, and there was no change in neutrophil counts. So in summary, the primary and key secondary outcomes were met with a 62 to 70% reduction in MRI lesions across the 2 treatment groups. All other secondary outcomes appeared consistent with the primary outcome. 838 was well tolerated with very few treatment discontinuations and no evidence of adverse liver, renal, or hematologic effects. Overall, these results compare quite favorably with other first-line and oral therapies in relapsing MS. Thank you for your attention.